If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at michelobultra.com/courtside. Michelob Ultra Courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at michelobultra.com/courtside for free entry deadlines, prizes, and details.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today we'll be reviewing 3 biochemistry questions. Just a reminder that you can also find these questions on our website at medprep2go.com. If you have any feedback or would like to get involved contributing to this free online and audio question bank, please contact us through the website, or you can reach me at ted.medprep2go@gmail.com. If you like what we're doing, please give us a review and tell your friends. And you can learn a lot more about me and my books and projects at tedxoconnell.com. All right, let's get started with the first question. A 4-year-old boy is brought to the emergency department by his mother with a painful swollen knee for the past 2 hours. She reports that the knee swelled after he fell on the carpet while running in the house. She witnessed the fall and reports that it was not a bad fall. He has no known medical history and is not taking any medications. Physical examination is consistent with a hemarthrosis in the affected knee. X-rays are negative for fracture. Which of the following is the most likely underlying cause of the patient's predisposition to this type of injury? A. Factor VIII deficiency. B. Factor IX deficiency. C. Factor XI deficiency. D. Immune thrombocytopenia. Or E. Thrombotic thrombocytopenic purpura. The correct answer is A. Factor VIII deficiency. This is a classic presentation of a patient with hemophilia. The patient is young. Hemophilias are typically diagnosed early in life. Hemophilia A at around 36 months on average. The patient is male. Hemophilias A and B are inherited in an X-linked recessive manner. And the patient presents with hemarthrosis of the knee, a classic example of a deep bleed that characterizes clotting factor disorders such as hemophilia. Hemophilia A is defined as factor VIII deficiency and is by far the most common hemophilia. The degree of bleeding correlates with severity of the hemophilia. More severe hemophilia may present with spontaneous bleeding, severe bleeding, or bleeding that occurs earlier in life and as early as birth. Patients with mild or moderate hemophilia may bleed as a result of trauma or during a procedure. Abnormal bleeding may not manifest until later in life. Answer choice B, factor IX deficiency, or hemophilia B, is far less common and is therefore incorrect. Answer choice C, factor XI deficiency, or hemophilia C, is also far less common, also making this answer incorrect. Answer choice D, immune thrombocytopenia, is incorrect. Immune thrombocytopenia is a platelet disorder characterized by superficial bleeds such as petechiae, purpura, epistaxis, or mucous membrane bleeds. Answer choice E, thrombotic thrombocytopenic purpura, is incorrect. Thrombotic thrombocytopenic purpura, or TTP, is also a platelet disorder characterized by purpura, which are purple-colored patches that occur on the skin and in mucous membranes, including the lining of the mouth. The key learning point here: hemophilia A is the most common hemophilia and is a result of clotting factor 8 deficiency. Remember that clotting factor deficiency 8, 9, or 11 matches with which hemophilia type, A, B, or C, respectively. Question 2. A 38-year-old woman presents to her physician to discuss genetic testing. She has no past medical history, but her mother died of breast cancer at age 42 years, and her sister was diagnosed with ovarian cancer at age 44 years. Genetic testing is ordered and reveals a mutation in the HER2 gene. Breast cancer is often caused by a mutation in the HER2 receptor signaling mechanism. This is an example of which of the following signaling pathways. This is going to be a mouthful. A, adenylyl cyclase / cyclic AMP / PKA. B, guanylyl cyclase / cyclic GMP / PKG. C, JAK / STAT. D, RTK / RAS / MAPK. Or E, TGF beta / SMAD. The correct answer is RTK / RAS / MAPK. There are many signaling mechanisms throughout human physiology. Some of these are implicated in disease processes when genetic mutations occur. The HER2 gene is part of the human epidermal growth factor family and codes for a receptor called RAS tyrosine kinase, or RTK, transmembrane protein. The RTK signal, when activated, phosphorylates the RAS protein, which sets off a signaling cascade that also operates through the MAP kinase protein. The end result is increased transcription of genes involved in cell cycle progression and cell proliferation. A common mutation of the HER2 gene is the HER2 new mutation, which creates a constitutively activated protein. The result is unopposed cell proliferation and differentiation, a hallmark of cancer. This mutation is commonly found in certain types of breast cancer. Cancers of this type can often be successfully treated with the monoclonal protein trastuzumab. Answer choice A, adenylyl cyclase / cyclic AMP / PKA, is incorrect. Adenylyl cyclase / cyclic AMP / PKA is involved in cellular metabolism. Answer choice B, guanylyl cyclase / cyclic GMP / PKG, is incorrect because this is involved in smooth muscular and vasculature. Answer choice C, JAK / STAT, is incorrect because this is involved in cell apoptosis. Answer E, TGF beta / SMAD, is incorrect because this is involved in the immune system. The key learning point here is that the RTK / RAS / MAPK signaling pathway is affected by HER2 mutations and is commonly found in certain types of breast cancer.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Question 3. And before I even start this one, I'm going to suggest that you just go look at Biochemistry 9 question on the website, because this one involves a figure that I'll try to describe. It's going to be a little bit challenging, and you're probably better off just looking at it, but we'll do it by audio just for the sake of thoroughness. A 37-year-old man presents to the physician complaining of night sweats and low-grade fevers for the past 2 weeks. He has a past medical history of asthma. His father has diabetes mellitus type 2, and his mother has systemic lupus erythematosus. He consumes an average of 3 beers per week and has smoked 1 pack of cigarettes per day for the past 14 years. He also reports that he occasionally self-administers heroin injections on the weekends. Vital signs are temperature 37.8 degrees Celsius or 100.1 degrees Fahrenheit, blood pressure 132/76, heart rate 75 beats per minute, and respirations 17 per minute. Physical examination is unremarkable. He undergoes P24 antigen testing and is ultimately diagnosed with HIV infection. His physician recommends initiation of antiretroviral therapy and prescribes a medication whose enzyme kinetics are shown in the Lineweaver-Burke plot below. And I'll describe this plot. There is an XY axis, a red line that starts to the left of the y-axis on the x-axis and goes upward to the right. And then there is a green line that starts at the same point as the red line and goes to the right, but is at a less steep angle than the red line. And this is labeled as uninhibited enzyme. Based on the information provided in the plot, which of the following antiretroviral drugs did the physician most likely prescribe? A. Darunavir, B. Delavirdine, C. Didanosine, D. Dolutegravir, or E. Zidovudine. The correct answer is B. Delavirdine. The Lineweaver-Burke plot can be used to visualize the type of inhibition that a drug exerts on an enzyme. Understanding how an enzyme's V and Km are represented in the plot is essential for answering these types of questions on the exam. V is the velocity, or the rate at which an enzyme works on its substrate. Vmax is the enzyme's maximum rate. On the Lineweaver-Burke plot, the y-axis is 1/v, or the inverse of the velocity. The y-intercept, where the line crosses the y-axis, is 1/v max. Thus, the steeper the slope of the line, the higher the y-intercept, the larger the value of 1/v max, and the smaller the enzyme's velocity V max. Km represents the inverse of an enzyme's affinity for a substrate S. So an increasing Km indicates a decreasing affinity for substrate. On the Lineweaver-Burke plot, the x-axis is 1/S, or the inverse concentration of the substrate. The x-intercept, where the line crosses the x-axis, is 1/Km. Thus, as the line shifts to the right, the x-intercept approaches 0, Km increases, and the enzyme's affinity for substrate decreases. The two most common types of inhibition are competitive inhibition and non-competitive inhibition. A competitive inhibitor structurally looks like the enzyme's normal substrate and will compete with the substrate for the enzyme's active site. A competitive inhibitor therefore lowers the enzyme's affinity for the substrate, increasing Km. There is no effect on Vmax. On the Lineweaver-Burke plot, since only Km increases, the x-intercept approaches 0, but the y-intercept, or 1 over Vmax, remains unchanged. A non-competitive inhibitor will inhibit the enzyme at a site that is different than the active site, lowering the enzyme's Vmax. There is no effect on Km. On the Lineweaver-Burke plot, since only Vmax decreases, the y-intercept, or 1 over Vmax, increases, but the x-intercept, minus 1 over Km, remains unchanged. In this question, the red line in the plot demonstrates non-competitive inhibition. The x-intercept, or minus 1 over Km, is unchanged, and the y-intercept, 1 over Vmax, has increased. Delavirdine is a non-nucleoside reverse transcriptase inhibitor, or NN-RTI, which binds to a site that differs from the active site of HIV reverse transcriptase and non-competitively inhibits the enzyme. Answer choice A, darunavir, is incorrect. Darunavir inhibits HIV protease and does not inhibit reverse transcriptase. Answer choice C, didanosine, is incorrect. Didanosine is a nucleoside reverse transcriptase inhibitor, NRTI, and resembles the normal nucleoside substrates of HIV reverse transcriptase, thereby competitively inhibiting the enzyme. The Lineweaver-Burke plot in the question displays non-competitive inhibition, not competitive inhibition. Answer choice D, dolutegravir, is incorrect. Dolutegravir inhibits HIV integrase and does not inhibit reverse transcriptase. Answer choice E, zidovudine, is incorrect. Zidovudine is a nucleoside reverse transcriptase inhibitor, NRTI, and resembles the normal nucleoside substrates of HIV reverse transcriptase, thereby competitively inhibiting the enzyme. The Lineweaver-Burke plot in the question displayed non-competitive inhibition, not competitive inhibition. So the key learning point for this question is that on a Lineweaver-Burke plot, competitive inhibition is marked by a rightward shift, the x-intercept approaches 0, and the y-intercept is unchanged, whereas non-competitive inhibition is marked by an increase in slope. The y-intercept increases, the x-intercept is unchanged. Non-nucleoside reverse transcriptase inhibitors, or NRTIs, such as delavirdine, inhibit HIV reverse transcriptase non-competitively. That is it for this episode. Please do check out our other episodes, and a reminder that you can find all of these questions and many more at medprep2go.com. And if you found this information useful, check out the Crush Step 1 podcast, which is the basis for the material in many of these questions.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.